Good evening. Hi, chefs. See you there. Hi, doctor. Good evening, everyone, and thank you for joining us. Tonight we are talking to Dr. Deo, and she is from Genesis Reproductive Centre. Sorry, that's in Pretoria. So, hi, Zana. Hi. Okay, so I'm just gonna send an invite, and she's coming on now. There we go. Hi,
Hello.
Deo.
Hi. Hi. Let me just grab my iPad.
No worries. You still at the
Yes.
office?
I am in the office, yes.
Oh, shame. So
It is
late. Thank you for joining us.
it is
Hope you
okay, yeah.
warm. Hope
Yeah,
you're
yeah,
warm.
yeah.
I,
The
I,
mom here.
okay, I considered putting on a gown this evening. It's so cold here, but obviously not
Oh,
as cold as it is there by you guys.
definitely. The snow is not doing us so well.
Oh, but it's nice. It's nice. We're very jealous down here.
Yeah,
Okay,
yeah.
so tonight, yeah, so tonight we're talking about stress, anxiety, and infertility. Um, So obviously stress does play an impact on your fertility journey and things like that. And one of the first questions we have is, how does stress impact anyone on this fertility journey? Um,
Okay.
but sorry, before I go ahead and ask that, could you please just introduce yourself to everyone that's listening?
Hi, everybody. I am Dr. Deo. I'm a fertility specialist based at Genesis Reproductive Centre, which is in Pretoria. And I'm very happy to be with you tonight. And hopefully, we can learn a thing or two from each other.
Perfect. Thank you very much, Doctor. So yeah, going back to our first question is, how does stress impact anyone on this fertility journey?
Studies have shown that women who have stress are twice as likely, are likely to take twice as longer to fall pregnant, as you've already said, compared to people who are supposedly mentally more fine as compared to stress, you know?
Yeah.
So there isn't any direct link that you can say that per se there is a pathology that you can say that it's linked to stress, but we know that especially people with depression, you may find that they are less likely to actually be engaged in sexual intercourse, and as a result of that, these people may then suffer from infertility, among other things.
No, we actually didn't think of it that way. Okay. You didn't think that because of the stress and anxiety, um, especially when you're doing on the plan where it's like you've got to do your homework, as the doctor would say sometimes, go do your homework on certain days. You're under so much stress that, that's the last thing on your mind. Am I right?
Yeah, one of the signs, symptoms of depression is actually decrease in libido. And when the
Yeah.
libido goes down, yes, from both male and female, by the way.
Yeah.
And if that happens, then there's no way of falling pregnant.
Yeah. Is stress every reason for not conceiving?
Not on its own per se, but we know that people who are stressed are less likely to fall pregnant compared to others. Even in IVF, we have found that people who are on IVF treatment may struggle to fall pregnant if they are too stressed compared to people who are stable. Yeah.
Okay. And what advice do you give any couple going through fertility journey that's managing stress and anxiety?
Okay. So there's a few things that a person has to go through. First, going through fertility treatment is stressful. And by the time you have been given this diagnosis that you have an issue of infertility, that probably is stressful on its own.
Yeah.
So I would advise the person that you must educate yourself. There's a lot of material out there. We put material in our websites as well that you can be able to educate yourself first about the condition, and second about the treatments that are going to be done, the journey that you will undertake. We've got timelines that we put on the website so that you can look at them and acclimatize yourself, especially if you're going to go through IVF, with what the process is going to entail. Then take care of your mental health. Keep a health check all the time to see, make sure that you are not deteriorating. The signs will be like lack of appetite, being irritable, not concentrating well, those kind of things. Make sure that you are physically fine, exercise, go for walks. I tell my clients to do hikes, talk to someone and talk to each other as a talk to your partner regularly and give them space to talk as well. Because research has shown that we don't actually focus on men as much as we should, and they actually also have stress as a result of fertility, of infertility. Talk to family members. You don't have to really go through the ins and outs of your problem as well as the condition itself, but just to inform someone so that you have a support group and people around you. And we also encourage our clients, psychologists. We work with a team of psychologists that you can consult with, that they can do some cognitive behavior therapy or something like that that can alleviate the stress.
Okay. And then what approach would you recommend someone takes going for IVF or IUI, any treatment cycles regarding their frame of mind?
It is quite important that you really try as much as possible to reduce stress, because I can't say that you can remove the stress completely, because obviously just by going through the treatment is stressful. But try as much as possible not to put yourself under too much stress. You must know that it is not completely in your hands. It's also not completely in the doctors, it's in the hand of God, but you're going to try your best. So try as much as possible to be in a positive frame of mind.
Okay. And then during infertility treatments, I think we are always waiting for the other shoe to drop. How do we celebrate the small positives or the tiny positives? What milestones should we be aware of?
Okay. So the mere fact that you have been able to secure an appointment with a fertility specialist is a milestone to celebrate, because it can take long for you to actually get an appointment. The next thing is that if you are going to go through the treatment, the fact that you have been able to secure funding, because not many medical aids pay. And if your medical aid is paying, that's also something to celebrate. That's a positive. The next thing is that your blood results have come, and such that obviously if you are using your own eggs, that they are good. If you are not using your own eggs, you have been able to secure a donor, be it a sperm or an egg. So each and every step that you, and I mean, celebrate seriously, before you go for your treatment, if you go out with friends, if you do something that you enjoy, and when you start treatment, when we scan and we say that we are seeing some follicles, yippee, go home and celebrate. That really, really helps, when we do aspiration, number of eggs that were retrieved, wonderful. Again, go and celebrate. And each and every time, pat yourself on the shoulder. Then we communicate with you daily to tell you how many have been fertilized. Each and every time you get that phone call or that email, whichever way that we communicate with you to tell you that it has happened, you keep celebrating. These are some of the ways that actually will reduce your stress levels. And then ultimately, when the embryo transfer happens, if we are doing IVF, and those embryos go in nicely, same thing, give each other hugs a lot if you're, as a couple, to celebrate. Set up things that you are going to do to celebrate in advance, so that when that time you can cash in, you can make a withdrawal on whatever it is that you said you are going to do for a child. And of course, the biggest celebration is when the pregnancy test is positive. And then the best for me is when I do that first scan and I hear the heartbeat, and then when the baby is born. So obviously for IUI, it's a bit different, because there it's just starting the treatment, seeing that follicle, and then the worst is when the woman is ready and the man is not able to produce sperm, because that can be very stressful, and they are standing there going in and out and this, your husband or your partner has not been able to produce the sperm, you know, and then when we get the sperm, we're like, yippee, you know, the boys are here. And then, or the girl, we put them in, and then the thing, wait for the pregnancy test, and God willing, it is positive. Do bear in mind, it is possible that at any stage things may not work, and it softens the blow. If you've gone through all that you've been celebrating, and then maybe you get to a point where now the pregnancy test is not positive, or hopefully you actually end up with a positive outcome. But we always tell the clients that if we get a positive outcome, wonderful. But you must prepare yourself for at least 3 cycles before we can be able to say, take a break or something.
Okay. We've got a question from one of our viewers is this if there is time, please ask the doctor if there are any specific supplements or natural products to take to treat stress, you know, while you're going through the process of treatment.
I'm not aware of natural products that can treat stress per se, but I mean that you can use to. It's good to take supplements, obviously, and most clinics will probably prescribe some other supplement for you. It is good to boost. Go on outdoor activities. It helps a lot. Hikes, you know, walks, those kind of things, so that you can release your own natural boosters to relieve your stress. Yeah.
Okay. Before I go to the last question, you mentioned things like, you know, getting support from your partner and things like that. And for example, recently we started we did one in Pretoria with you as well, but we recently, a few months ago, we started the support groups here in Cape Town. And I think this has helped. And I know that for the ladies that's listening, that's in Pretoria, Genesis also has a support group there. Maybe you can give them some details and maybe tell us how the support group helps you when you are going through a fertility journey, when you are on, you know, going through treatments, how that support group can help you, and speaking to other women that are also on this journey.
Correct. We have support groups that happen, I think, almost every second or third month. The next one is coming, I think, 15th of August. If you go to our site, you will get the correct date, or if you contact Genesis, you will get the correct date. It's usually a small group of people that are either preparing to into the journey or that are in the journey. We encourage that it should be a couple, so it's couples that usually attend, but obviously if you come on your own, it is also fine. And it helps that you know you are not alone in this journey. There are other people out there that are going through the same thing as you, and we found that listening to other people's stories and how they have coped can actually help you a lot, or help another person. And sometimes it just helps you to realize, oh my word, my situation is not as worse as I thought, you know. There are other people who are worse than mine. And the nice thing is when you get to hear other people's positive stories, because that gives you hope. Because at the end, everything that we have to give you hope that there's a possibility, without necessarily giving you false hope or lying to you, but to know that this treatment does help. So being in a support group helps. It is not a therapeutic engagement. It's a place where people who are not medical get to share. With our support group, we've got sisters that are there. We have a psychologist that joins in as well, so which is very nice, because Anine comes in and she can discuss some of the issues that people may talk about, and then it almost gives you like group section together, and then you can further on go on and see the psychologist on your own. So we don't use it as a clinical intervention, but just a safe space for you to breathe and get to interact with others.
Thank you very much. So if you guys are looking at joining a support group, you can go to the Genesis website. If you're in the Pretoria area, go to the Genesis website and you'll find all the details on there. For the women in Cape Town, you can contact me. I have one every month, every second week of the month at a different clinic, so you can just contact me for that as well. And then we're going to go to the last question, Dr. Tebogo. The relationship between a doctor and a patient should feel comfortable enough to ask the tough questions. How do you build up that rapport with your doc?
So you must really feel free to talk to your doctor. Ask anything and everything.
Yeah.
Make sure that you relax. Do your research in advance about your doctor, because most of, I mean, all fertility doctors have been trained, so they really know what to do. But you must check the person and see whether your personality and their personality will actually not clash. And it's also
Yes.
important to check that your belief system is the same, and make sure that you are able to reach them. They're contactable, be it the doctor or their sister who does the coordinating for them, but
Yeah.
there must be somebody that you coordinate with, because it is a stressful journey. It can be a long journey. So it's important that when you feel like you are in a partnership, and you must feel like your doctor has got your interest at heart, and they are actually walking this journey with you,
Yeah.
and you are a person, you are not just a number, you are a human being, and this doctor sees
Yeah.
you as a, you must be made to be feel like you are the client in front of the doctor. It's not like I'm
Yeah.
waiting for the next person in. You're the one that
Yeah.
matters. So make rapport and make sure that you feel okay. And it's okay to move to somebody else if your
Yeah.
personality is clash. Yeah.
Yeah. Because I always feel that when you're with a doctor, and especially a journey of when you're doing treatments and stuff like that, your doctor has also become invested. And especially if
Right.
you're both on the same page, your doctor also, they also celebrate the wins with you. The small wins you're talking about, they're actually celebrating it with you. Am I correct?
Correct. It's actually a big deal. When we have
Yeah.
that positive pregnancy test, everybody celebrates in the lab. So, I
Yeah.
mean, it's your baby. Actually, it feels like it's our baby.
Yes.
So we would Mrs. Lee is pregnant, and like,
Mm.
yay, and we call each other and inform each other about that, about your success. The same way that if you were not pregnant, we also share that, and we are sad with you, because we want to
Yeah.
see you in this very stressful journey of yours. We want the outcome to be positive.
Awesome. Thank you very much, Dr. Deo. Do you have any closing comments to make, or anything you want to tell us about, say something to us, to the women out there?
Okay, women out there, indeed, fertility can be stressful, but if you have the right support around you, it is possible to walk the journey together. Talk to your doctor, keep in touch. And the worst time is when the pregnancy test is negative. Make sure that you contact your doctor, come and talk about it, get that debriefing session. Make sure that you see the other health professionals, psychologists, like I said. Come and see us at Genesis. Join us at our next support group, so that you can be able to share your issues with us and with other women who will possibly, or other couples particularly, who will possibly join us. And hopefully we can be able to help you. And as we always say, that we are in the business of bringing hope to families, and to make sure that we can be able to get that little bundle of joy in your hands. And thank you very much
Okay,
again, Lady.
thank,
Yes.
thank you very much, Dr. Deo. Thanks, Dr. Deo, for taking the time out to do this talk with us, to bring some hope and some wisdom and guidance to the women out there that's dealing with infertility, that's walking on this road. If you guys have any questions for Dr. Deo, you can get it at, you can visit their website. It's the Genesis Reproductive Centre. They are in Pretoria. So the ladies in Pretoria, we've got something great coming on the 3rd of September. So please put that in your dates. We're hoping that Dr. Deo is one of the speakers if the event,
Yes.
or otherwise there will be one of the other ladies from Genesis, one of the other doctors from Genesis that will be joining us. But until then, please, you can just DM me if you have any questions, or you can go directly to Genesis has a Instagram page as well. You can contact them there. If you're watching this on YouTube, please subscribe and like. And if you're on Instagram, you can watch all these videos as well on the Instagram or on our YouTube page. So thank you very much, everyone, for joining, and have a great evening. Thanks, Dr. Deo. See
Thank
you.
you. And any more questions, you can send them to us at reception at Dr. Deo, which is DRDEO, and then .co.za, and then we can answer them for you. Thank you.
Perfect. Thank you very much, Dr. Deo. Have a great evening.
Thank
Bye.
you.
Bye.
Goodbye.